Okay, good evening, everybody. I hope I am clearly audible. Can anybody please confirm?
Yes, ma'am.
Okay. So, for people who are joining for the first time for the problem solving session, so I am Sharmishta Majumdar and I am one of the PMRF TAs who are taking the problem solving session for this course, Maternal Infant Young Child Nutrition. And this is being taken by Dr. Rupal Dalal from IIT Bombay. So, we'll move on to our problem solving session for today. So, for today, we will be discussing some of the problems related to the content of week 9, that is, the issues faced during complementary feeding. And as you have all gone through the content of the previous lectures, where we have talked about the essentiality of breastfeeding and what are the guidelines of breastfeeding, the different kinds of breastfeeding, and then what are the specific points with which the breastfeeding techniques should be employed, and then we have learned about complementary feeding. So last lecture we have learned about the guidelines of complementary feeding, what kind of food needs to be fed, and which are the food groups, and what is the requirement of those food groups. And also we have talked about the preparation of the food and the specific storage of the food. So now we'll be talking about some of the problems which are related to the issues faced during complementary feeding. But before moving on to the specific questions, I would like to just a moment. So some of you had raised a query regarding the solutions of the lecture 7 not being available on the portal. So as far as I know, they have been just recently updated, but I have also attached the solutions in this PowerPoint. So, in any case, anybody of you has any queries related to the solutions of the week 7 assignment, you can also go to this document. I think you can all see the different questions are given and the correct answers are also marked. So, through this presentation, yeah, you can also access the lecture 7 solution in case if you have any queries. So, is there anybody who has any queries related to any question from assignment of week 7? I'm assuming there is nobody. Okay, so maybe you can just go through the answers, and of course, it has also been updated on the portal. So now we'll move on to the problems. Okay, so the first problem, so as we are just discussing the practical issues which are related to the complementary feeding, so of course if we are talking in terms of the severity of the questions, so these questions are pretty simple, but of course you'll be getting questions like these only in your assignments and in your final examination. So please go through the questions and also practice these kinds of MCQs because they are important from your evaluation point of view. So the first question is, which of the following should the child eat in the morning? Right. So a lot of you have
Third
already.
option.
Yes. So the third option is the correct answer. That is nutritious breakfast before milk. So as we have already gone through the recorded lectures, and also we know that only through milk or only through cow milk the entire nutrition which is required for the child cannot be substituted, right? And also if the child during complementary feeding is only having a glass of milk or only having tea or biscuits, so that is definitely not adding up to the entire nutritional requirement of the child. So obviously a very nutritious breakfast before milk is required for the child, where in our Indian families mostly what we eat in the morning, they are very carbohydrate rich food, right? So the kinds of aloo paratha or poha or whatever the specific kinds of food that we eat in the morning, so those are carbohydrate rich. So the attempt would be to remove these carbohydrate rich food and try to accommodate protein kinds of food for the child's daily diet. So for the nutritious breakfast along with milk, the child should be given proper amounts of protein rich food and also fruits, right? So the child needs to have a proper balance of proteins and also the different kinds of vitamins and minerals. So yes, the correct answer for this question is nutritious breakfast before milk. So we'll move on to our next question. How much fruit juice should a child under 2 years of age drink? Anybody with the answer?
Option 2.
Okay. So we have most of you answering option B, right? So child should not drink any fruit juice. Yes. So practically, if we think about these situations, we have seen children who drink fruit juice, or maybe their parents are giving them fruit juice. But ideally, it is not recommended that children below 2 years of age, they have these fruit juices. If at all, not if at all, obviously the fruits need to be given and they have to be given in their whole form. So whenever we are talking about fruits being given to the child, so it should be the whole fruit in the place of fruit juice. And of course, whenever we are considering the different commercially bought sources of fruit juices, so they are full of refined sugar, and it is not at all advisable that the child be given these externally bought fruit juices. Yeah. So of course, the commercially brought or the packaged fruit juices are a strict no. They are a strict no. And also, if they are given fresh fruits, so these fresh fruits should be given in the whole form. So there will be two advantages related to it. So the first thing, since the child is already in a teething phase, right? So the child has started to get the different kinds of tooth. So there are incisors, there are canines, there are molars, there are premolars. So of course that will sensitize the entire oral environment of the child as to how the chewing can be mediated. So it is very important that fruits given in smaller pieces or in whole pieces, they are given to the child. So yes, I can see somebody has written a different option. So please keep in mind, children under 2 years of age, it is advocated that ideally they shouldn't be given any fruit juices because they are the major sources of refined sugar, and so they can be more deleterious than being advantageous as to give the advantages of fruits. So whenever we are giving these fruits to the children, it should be more in their whole form, right? So we'll move on to our next question. What should the mother do when the child demands for a certain food only and refuses to eat the family meal? So can anybody tell me, when do we advocate the family meal? What is the stage of the child, or what is the age of the child when we are advocating the family meal?
9 months. 9th month.
Okay.
1 year. After 1 year.
Right. So the lower threshold or the minimum stage when we are advocating a family meal for the child is at 12 months, right? It is not 9 months. Please be careful. It is 12 months. So at the stage of 1 year, when the child is of 1 year, so at that time we can start giving the child the same kind of food that the entire family is eating, right? So that is the family meal. Now, what if the child refuses to eat the food that the family is trying, or the other members of the family, they are eating? So definitely here, it shouldn't be the decision which would be made by the child, but it should be the decision which is made by the mother, right? So anybody with the answer? We have the options here.
Option third, madam.
Right.
Option B.
Right. So if we go through the options, Say the first option says mother should cook the food the child wants. So obviously that should never be an option, because whenever the mother tries to please the taste buds of the child, so that is when the entire nutrition cycle goes for a toss. So hence obviously the first option can never be the correct answer. Neither for an examination point of view nor in practical situations, right? So second, mother should force feed the family meal to the child. So we have also observed a lot of mothers or a lot of people in different families that okay, the child is not having it, so okay, we'll force feed that child, but that will agitate the child more, and that will repel the child more. So also the mother shouldn't force feed the meal to the child. Next, mother should let the child choose between eating the family meal or staying hungry, and mother should order the special food for the child from outside. Also, outside food is a complete no. So mother should let the child choose between eating the family meal or staying hungry. So these are the formative years of the child, and also the child is developing his or her cognitive abilities. So this is a situation where the child is given the freedom to choose that whether they should eat the family meal or whether they want to stay hungry. So this would be a proper way where their minds can be sensitized as to eating the healthy food, or as to that they are supposed to eat what the entire family is eating without throwing any tantrums. So the answer to this question is, as you have correctly said, mother should let the child choose between eating the family meal or staying hungry, right? Okay, so we'll move on to our next question. How many times should a new food be introduced to children even if they don't like it? So what do you think the answer should be?
10 to 15 times.
Okay, anybody else? You can write down your answers in the chat box as well.
Ma'am, I was not clear about the frequency, like in a week, in a month, how frequently a new food should be
Okay,
introduced.
so this question, are you talking specifically about this question?
Yes, ma'am.
Right. So this question, this talks about, we have learned previously that whenever we are introducing a specific kind of new food, we are supposed to introduce these new foods every 4th day, right? So what if you are introducing this new food and the child denies to have that food? So will you give up? Obviously you will not give up. So now what is the minimum advocated number of times that you will try to feed that child with this same group of food? Say for suppose you are giving say some vegetable to a child, so that child is not taking in. For example, if we say we have started giving, we have introduced broccoli to the diet of the child, right? Yeah. So first day you introduce broccoli and you see that the child denies having the food. So then again, after 4 days, you introduce something else, because of course you have to, acclimatize the child's taste buds as well. So now what happens? You try to introduce that broccoli again. So now the question asks you, for how many times will you keep on introducing this specific food, so that the child's brain gets acquainted to the taste, right? So here I will go on to the answer and then I'll explain for all of you. So a lot of you have written twice, right? So this is about introducing that same group of food to the child over and over again, so that the child gets a hang of its taste. So how that food looks, how that food tastes, or how does that food smell. Yeah. So the entire sensory, like all the sensory perceptions of the child, will be entirely related to the specific kind of food. So basically this is about the number of times you are introducing that child to this food, so that the child can now make his or her own decision whether they like the food or they don't like the food, right? So this frequency, like as they say, it is not a feeding frequency, but it is a minimum number of times where you will introduce it. Like say if the child is not having one kind of food, so of course the mother won't give up after feeding him 5 times, right? So the mother has to try for at least 15 to 20 times, or say for the matter of the question 10 to 15 times, to acclimatize the child to the food, right? I hope am I clear? I mean, have I been able to clear your question?
Yes, ma'am. Thank you.
Right. So, as I just discussed, that it needs to be, the time needs to be given to the child so that they are also able to have that perception in their brain that, okay, this is how this food looks and these are the different features of these food. And then they can decide, okay, now I like this food or I don't like this food. So now if we feed the food twice to the child or say 5 times to the child, it might happen that the child is biased towards some other food taste. So he might deny taking this food. But of course, repetitively giving that child 10 to 15 times or 15 to 20 times gives us an advantage to, sensitize the child to that taste. So the answer to this question is 10 to 15 times. Please keep this in mind. This is not a specific frequency of feeding the child, but a minimum number of attempts that you need to introduce that specific kind of food to the child. So we'll move on to the next question.
Excuse me, ma'am.
Yes.
Ma'am, in the assessment, in the assignment, sorry, sometimes now, like once in a while, it happens that the meaning of the question is not very clear.
Okay.
Maybe I'm not able to understand it, but I was thinking if in the exam we come across any question like this,
Okay.
then
Okay. So one suggestion I would have for you is that the questions that would be given to you or that are being given to you in the assignments and also that will be given to you in examinations, they are entirely related to your lectures. Okay. So I would suggest you to go through the lectures very meticulously. So every point has been very clearly explained, and in case you find that okay, you are finding it difficult to understand a question, you go through the options again. You read the question, you go through the options again, and I guess you'll be able to do it. It shouldn't be a problem. Like these are very straightforward questions.
yeah.
Okay.
Thank you, ma'am.
Yeah.
Yeah.
So next question, what is the upper limit of dairy products per day recommended for children? Okay,
Option C,
right.
500 grams.
Yes. So option C,
100 grams.
yeah. So as you have already said, option C or option number 3, 500 grams is the correct answer.
Here there is a problem, madam. The question also. See, upper limit of dairy products is given.
Which age,
Sometimes-
right?
Yeah, age, and also the milk is in the liters, not in the milligrams.
Yes. So here, if you read it carefully again, this is dairy products. So it is not just milk, it is dairy products. So this is one thing. And the second thing about the age part, that I understand, but of course these questions, they have been specifically taken up from the question banks that are designed, that have been designed for you people. So of course I haven't changed the, the language of the question. But of course, the age part I understand because that is not clear. But if you again go through your lectures, so these concepts have been very clearly discussed. So you can take into consideration that since they have been discussed properly, so you can assume that these kinds of questions will be asked to you, right? So this is number one. And number two, as I have mentioned, it is not just milk, but we are also talking about the dairy products. So when you go through the recorded lectures, you will, maybe you can just recapitulate. Whenever we are telling about the upper limit of dairy products, it is not just the milk, but also the kinds of other dairy products which are being given to the child. So that may be paneer, that may be curd, or any other kind of dairy products. Say, in some other situation, if some other dairy, any sweet made from any dairy is given to the child. So it is advocated. Yes, somebody raised a question.
Ma'am, sorry.
yeah.
After I just wanted to talk after you explained this.
Yeah.
The thing is, I had last time I had asked a question, regarding the answers of the solutions of the seventh week questions.
Right.
I had asked in the question section that you had told me,
Mm-hmm.
but there was no response and there's no update also.
Yeah.
That
I'll
means
just
they
come
don't
back. I'll
answer
just
the
come
same
back to
answer.
that. Give me 2 minutes. I'll
Yeah,
come
yeah.
back to that.
Sure.
Okay. So yeah. So for this question, so this is not just the this is not just the milk. So hence the options that have been given are in grams. So they are also talking about the solid form or the solid dairy products like paneer or curd. So whenever this is taken into consideration, it is advocated that a child should have maximum of 500 gram of all the dairy products cumulatively taken into account, right? So I think I have been able to clear your questions that you had regarding the unit and the unit in the options, right?
Yeah, yes,
Is it
ma'am.
fine?
Thank you.
Yeah. So please go through the questions. Like these are very straightforward questions. There is nothing to get confused or anything. You go through the recorded lectures. Your questions will be very straightforward. Just read the options and your answers are in front of you. Just don't get confused, right? Okay. So before moving on to the next question, I would just like to clear the doubt regarding the assignment 7, right? So today only at the start of the problem solving session, I have talked about it. Maybe I'll just repeat again. So if you go through your portal, you will see that the assignment solutions, they have been updated. Okay, so there has been an email communication, but I am not sure whether it has been to everybody or not. So if you are you can find the solutions in the same the portal where you usually find all the answers. Apart from that, in this presentation also I have added the answers. You can see, if you click on this lecture 7 solution, you will see this document. So this document has all the questions that were there in your assignment 7, and of course you have the correct answers marked here. So in case you have any issues assessing the solutions in your portal, you can also go back to this presentation and take a look at the answers. I hope I'm clear.
Yeah, sure. Thank you.
Yeah, okay. So we'll move on to our next question. Yeah. So our next question is, what could happen if children eat too many dairy products every day? So now we have just seen that they are not supposed to eat over 500.
Yeah.
Yes, okay.
Yeah, option A.
Right. So they are not supposed to eat over 500 grams of cumulative dairy products in a day, right? Now, what if these children, they eat more dairy products than it is necessary for their body? So what will happen? So very rightly, as you people have said, eating more dairy products than what is required for the body will lead to iron deficiency anemia, right? So here we can talk about the two possibilities. We have the human milk and the cow's milk, right? So in cow's milk, we had discussed in our previous sessions that the amount or the percentage of iron is very less. So if somebody is having dairy products, so that iron is not even being supplemented in adequate amounts into the body. So number one, it is deficient in amount. Number two, the iron might not be able to, the iron might not be absorbed properly in the body. So unless and until something, a macronutrient or a micronutrient is properly absorbed into the body through the digestive system, if it's not absorbed, it will not be able to play any function in the bodily mechanisms, right? So the absorption is also poor. So now what happens, because of this less amount of your iron, and also the poor absorption. So because of this, the entire stores of iron is depleted in the human body, and that can be a causative factor for iron deficiency anemia. Again, another thing that might happen if the child is more concentrated into eating more of dairy products, so the child might deprive himself or herself from eating more nutritious food, like say vegetables and fruits, which are more rich in vitamins and minerals. And so, say for example, red meat and other leafy vegetables, which are very rich source of iron. So, if the child is not again having these leafy vegetables and red meat, so that also in this entire cycle leads to iron deficiency anemia. So, it is very important that the child, we have heard about a lot of families in the Indian scenario in different rural areas, and we keep on hearing these stories that our child has grown up, you know, tall and strong, drinking a lot of milk, eating a lot of dahi, paneer, chhach and all of it. But yeah, but then again, this concept comes into consideration whether or not these children are anemic or not, right? So please remember, whenever we are seeing a child or whenever we are seeing a mother trying to, you know, feed the child a lot of dairy products, so this iron deficiency concept should also be very significantly kept in mind. And in case the child develops iron deficiency, then again the proper supplementation also needs to be started, so that the child doesn't have a very clinically deficient anemic state. Because iron is responsible, we have gone through it a lot of times, iron is responsible for the different cognitive growth and development of the child as at various stages of its development. So iron is indispensable. So hence these things need to be kept in mind when any child is having a lot of dairy products in a regular diet, right? So yes, the correct answer is iron deficiency anemia.
Can I ask you a question, madam, here?
Yes.
Actually, the iron content in the cow's milk or the buffalo's milk is less. So when you compare with the buffalo milk, cow's milk is certainly less.
Yes,
Why are we
it is
significantly highlighting only cow's milk? Why can't we say animal milk?
Yeah, we can say animal milk also. It has been taken from a reference, so it has been mentioned cow's milk. But definitely it can be any animal milk, any animal substitute, say cow's milk or buffalo milk or goat milk, right?
Thank you.
Yeah. So next question. Kids' parties or any special occasions are always celebrated with sweets. How does this change the child's mindset? So we adults also like sweets, so children will also like sweets. So what do you think is the answer?
Point B.
Correct. So the child,
Option B.
yes, so the child believes happiness equals sweets and eats them more frequently. So we adults have also been made to think, we have gone through a lot of research that has been going on, that dark chocolate makes us happy, dark chocolate is good, and chocolate makes us really happy. So the sweet rush, that gives us a feeling of happiness, and that is the reason why we get attracted to sweet foods. Now if these children are so much attracted to sweet foods even at the nascent stage of their growth, so that will be deleterious for them, because these refined sugars won't allow the other kinds of nutrients to give them the proper kind of nutritional requirement that they deserve, that the children need, right? So hence we have also discussed this in our previous sessions, that whenever we are initiating complementary feeding, the sweet taste is the last to be introduced, right? And that is also not in the form of any refined sugar, jaggery, honey or anything. It is through fruits. So please remember, whenever we are also introducing the sweet taste to the child, it is also through fruits. And there are also some places in India who there are different communities in India who have this practice of feeding honey, jaggery, and this what is this sweet sweet stuff, which is just when the child is born. So as we have all seen, definitely all these are contraindicated at birth, and also when the child is being getting the complementary feeding. So at that time also refined sugars, honey, jaggery, these are not to be given at a very frequently. So this the answer is definitely B. So whenever we are dealing with dealing with people, or dealing with new mothers, so it is very important that we make them understand, we motivate them and tell them that okay, your child wants it, but it doesn't mean that you have to keep on giving the child that specific kind of food, right? So yes, for this question, the answer is child believes happiness equals sweets and eats them more frequently. So to combat this situation, it is very essential that the child during complementary feeding be given the sweet tasting food as fruits as the source of that sweet taste, so that a proper balance is also maintained between the fruits and also the other kinds of food groups, right? Okay, so we'll move on to our next question. How many meals should a 1-year-old child eat per day? We have discussed this the last session
Option
also.
4, 5 meals a day.
Right.
5 meals a day, ma'am.
5 meals a day, correct. So when we were talking about the 6-month baby or the 7-month baby or the 8-month baby, so every time the baby is growing, the requirement also increases. So similarly, when the baby is now at the verge of 1 year or 12 months of age, so now the baby's requirement has increased 4-folds or increased many folds. So now what happens, along with breastfeeding, the child now needs at least 5 meals. So hence the 1-year child or the 12 months old child, they have a requirement of a minimum of 5 meals along with breastfeeding, right? So please remember all these age stages and what kind of requirements they have. Say for at a stage of 7 month or at a stage of 8 month, what is their requirement, and how much of food do they need. So for your purposes of your examination, please go through these carefully, right? Okay, so we'll move on to our next question. What should be the consistency of food given to a 1-year-old child?
Option 4, like family meals.
Yeah, I am sure by now all of you are very much clear. Whenever we are talking about a child who is already 12 months of age, 1 year of age, so now the child needs to be put into the habit of eating with the other members of the family. So yes, the answer to this question is like family meals. Okay. So for this question also, like for the previous question, as I said, what is the requirement? So in these kinds of question also, please remember what is the specific kind of consistency, right? So what is the different kinds of consistency of food that is being given to the child at different ages, okay? So please go through these also for your exams. Okay, so how much food should a 1-year-old eat per meal? Answer?
1 cup.
1 cup. 1 cup.
Option 4, 3 cups.
1 cup. 1 cup.
Okay. So anybody, why somebody said 3 cups? So why do you think it's 3 cups?
Yeah, I think I'm wrong. I felt it should be between, it should be more than 1, but there was no 2 cups.
Okay. So
Yeah, I think 1 cup.
yeah, the answer is 1 cup. And whenever we go through the requirement of the 7-month-old or 8-month-old, so the babies at that stage, they require a half cup of it, right? Half cup of food. But whenever we are talking about the 1-year-old child, 1-year-old child, so we will go with 1 cup. So in the tutorials that you people have seen, so this is a kind of cup that they are referring to, and I think there was a question last time regarding this, but irrespective of other guidelines, I would stick to the tutorial that has been given to you people. And this is an approximate volume of 250 ml, right? So this is the cup which has been used as a reference whenever they are saying the 1 cup or half cup in the tutorials, right? So for a 1-year-old child, per meal their requirement is of 1 cup. Okay, so we'll move on to the next question. If the mother gives healthy food to the child on special occasions, such as dishes from the celebration recipes tutorials, how does it change the child's mindset? So of course there are a lot of very informative recipe tutorials that are there on the portal. Of course I will not be discussing problems on these recipes, but they will be very helpful for you people at the practical front, right? So please go through all of these. And coming back to the question, so what do you think would be the answer?
Option 4.
Okay. Anybody else?
Option 4, ma'am.
Option 4.
Okay. So now whenever we are treating the child with different kinds of food taste, right? So now if we give them sugar, so the child will get more acclimatized to that sweet taste. And if we train that child to eat healthy food, so this is all about the training period of that child as to how we are training the child to eat what kind of food, right? So also, as we discussed, that is the formative period of the child's cognitive abilities and also the decision making abilities. So at that point of time, if we judiciously train the child as to what are the pros and cons of eating these different kinds of foods, and if we properly mediate the kinds of healthy foods during the different kinds of occasions in homes or whatever, so this will lead to the child trying to have healthy food himself or herself. So this is also all about training, how you are training the child to have the specific kind of healthy options out of the different kinds of food that are available for them, right? So yes, the answer to this question is child looks for and selects healthy options on all special occasions. So we'll move on to our next question. So as I have said, these questions are like very easy and very straightforward, but practically we also need to keep this in mind, right? Because I am sure, in many of our houses, we have seen, or maybe we have ourselves given a cup of tea or maybe a little bit of tea to a child, right? So these are things which we are learning, and now we know that these things shouldn't be done. And it is also our responsibility to educate and motivate the people who are there and who do not have the access to all these information, so that they get to know that what they are supposed to do and what they are not supposed to do for for the benefit of their children. So now coming to the next question, how much tea or coffee should a 1-year-old child drink?
Option A.
Option 1.
Okay. Anybody else?
Option 1.
Okay. So I hear only 4 or 5 voices for all the questions. I hope
We go with those voices.
yeah, I hope the others are not sleeping. Okay, so we have responses. Okay, never mind. So definitely the answer to this question is the child should not be given any kind of tea or coffee, and the American Academy of Pediatrics has advocated that the children who are under an age of 12 years, they should not be given any source of caffeine. So any source of caffeine doesn't necessarily only mean the tea or coffee. These also include the different kinds of caffeinated beverages that are available commercially, right? So it is very important to keep in mind that children shouldn't be given, because it is a very common occurrences that we see in children, that whenever they are seeing the adult sipping on tea or coffee, they also feel like having it. They also say like, okay, I also need some coffee. But then it is the responsibility of the adults to know that, okay, children are not supposed to be given these tea or coffee, because of course they have tannins and they have caffeines which can mess up with the entire metabolic functions of the child. So initially it might be not that major, but these can also cause different kinds of adverse health effects in the child. So it is advocated that no kind of tea, coffee or any kind of other beverages which also has caffeine, and of course they are a very rich source of sugar, so these should never be given to children below the age of 12 years, right? Okay. So we'll move on to our next question. A mother feeds an expensive formula milk to her baby, yet the formula does not protect the baby. Why? Answers. Why is everybody silent now?
Bullet 1.
Okay. Anybody else? It's again a very straightforward question. You have gone through the concept. Please read the the options and you'll just get the answer.
Option 1.
Okay. So these have already been discussed before. Like these concepts have very, they have been discussed many a time. So yes. Yes, somebody was saying something. Okay, so let me just go to the question. So now what does the question say? So the mother is feeding a very expensive formula milk to her baby, but the formula does not protect the baby. So whenever we are talking about protecting the baby, so what do we know about protection? What does this protection stand for? Of course, that is the immune system of the baby, right? So this protection is protection against the germs or the different kinds of microorganisms that are around. So what do we know? Okay, let me ask this question. So when we are talking about breast milk, what is the major difference between breast milk and formula milk in terms of these immune protective agents? How will they protect the child, or will they protect the child or not?
Like
They
breast
protect
milk
the-
has colostrum also, which
They
gives
protect-
lifelong immunity to the baby.
Okay. Yes, somebody else was saying something.
And it has a lot of antibodies which helps the baby to avoid from allergy and other problems.
Right. So let us just recapitulate a bit. So the first milk which is coming, it is the colostrum, right? So the colostrum is very rich in all these antibodies. So can anybody tell me which is the antibody which is present in colostrum in major amounts? Okay. So let us just recapitulate. We have discussed this and we have gone through problems in the same areas. But again, let us just talk about it. So whenever we are talking about these immune, agents, so there are some antibodies like antibodies, these are called Ig or immunoglobulins, right? So immunoglobulin G, A, M, these are all present in breast milk, right? But in colostrum, specifically, the immunoglobulin A is present, which is giving a major chunk of immunity to the child, like immediately after birth. Now, whenever we are talking about breast milk, as I've just mentioned, we have all these immune agents that they are fighting infection. So infection fighting factors, they are present in breast milk. Now let us come to the question. The mother is feeding formula milk, right? So the formula milk is a synthetically made milk. I mean, it is processed in a synthetic manner and it is made in that way. Like it's not a synthetic milk, but it has been processed, right? So now these formula milk, they do not have those infection fighting properties. They do not have those factors. So number one option, formula feeds do not have antibodies, living cells and good bacteria, thus resulting in increased risk of infection. So I would also suggest you people to go back to the previous sessions. We have talked about in the session where we have talked about the composition of breast milk. We have seen that there are different kinds of antibodies. There are different kinds of beneficial bacteria which is present. Can anybody tell me what is present in breast milk that is helping in the growth of beneficial bacteria? We have gone through all of these in the composition of breast milk. Anybody? Am I audible?
Yes, ma'am, but we don't know the answer.
Okay. So let us just recapitulate. So if you go to the composition of milk, do you remember we have studied about something which is called bifidobacteria? Can you remember?
Yes.
Bifidobacteria, right? So the first option, which is talking about antibodies, living cells and good bacteria. So these are all the different kinds of components which are present in breast milk, right? So for example, antibodies are present. Bifidobacteria is one kind of, bifidobacteria factor is present, which is helping in the growth of bifidobacterium, which is a good bacteria. So all of these, they are present in breast milk, but they are not present in formula milk, right? So the answer to this question is option A. So whenever we are talking about formula feeding, so there is a chance of giving more sugar to the baby because there might be more amounts of refined sugar, right? The formula can be made with genetically modified organisms, that is the GMOs. So we are again exposing the child to these kinds of GMOs. There might be risk of allergies, then again synthetic vitamins, and also increased risk of fat deficiency. So these are all disadvantages which are related to formula feeding. But on the other hand, when we are talking about breast milk, now what are the advantages? Now since the mother's milk already has those antibodies, the mother's milk already has those immune factors. So the child, when the child is breastfeeding, so through the milk it is already getting that antibodies, the maternal antibodies, and that is helping the child to develop its own immunity, right? So this is the immunity which is when the child is born. So of course the child doesn't have the immunity of his or her own. So what is the first stage of immunity? How will the child save himself or herself from different kinds of infections? So that is the immunity which is being passed from the mother to the child through the breast milk, right? So second, with this, of course, since there are different infection fighting factors and allergy fighting factors, the chances of allergy also reduces. And as we know, we have gone through this, the whole process of feeding breastfeeding, it aggravates or it expedites the bonding between the mother and the child. And also there is weight normalization, like with the feeding of breast milk, the child, there has been seen that even underweight child, they have beautifully grown into proper weighted babies. So is there any confusion related to this question? Have you been able to remember what you had previously studied or anything? Any queries?
Clear, no, thank you.
Okay, so please keep in mind, it is the mother's milk or it is the breast milk which has got the infection fighting factors. The formula milk doesn't have it, right? And hence formula milk should never be given to the children because of course they are devoid in all these factors, and it doesn't make sense if we keep on giving no matter how much expensive formula milk to the child. It is not doing any benefit for the child, right? Okay. So we'll move on to our next question. Please go through the previous sessions. The questions are all very related. It is, it's a very related concept, right? So, there is no need to get confused or anything. So we have gone through this whenever we are talking about breast milk, we are talking about the composition of breast milk, right? So these things, they are just being repeated. The questions are just being repeated in a different form. Okay, so we'll move on to the next question. Mothers supported by health workers have been exclusively breastfeeding their babies for the first 6 months, but the babies are still not gaining enough weight. What could be the most common reason for this? I think all of us, we know the answer.
Bullet one.
Option
Yes.
A.
So all of us, we know the answer. This is one of the major reasons why many of us, we are taking this course. We are getting to know a lot of new things about the breastfeeding techniques, right? So it is, we have seen that a lot of healthcare workers, a lot of, Anganwadi workers, a lot of new mothers, they are trying very hard, and they are getting supported by different kinds of health workers to know the specific techniques of breastfeeding. But sometimes what happens, even after employing those techniques, they are not able to see an advantageous or a beneficial weight gain or a good weight gain in these kind of children. So hence, the most common reason due to inadequate knowledge about breastfeeding skills in mother and other healthcare workers. So we have gone through the different kinds of breastfeeding techniques, and whenever we are talking about the latching during breastfeeding, so those points also, they are very important. Why we are saying that the mouth of the child should be properly, there should be a deep latching, and it should engulf the nipple and the lower part of the areola. So there might be situations where people think that, okay, the whole breast needs to go into the child's mouth, and that is how the breastfeeding can be done. But of course, no, these are the different technical intricacies, intricacies that need to be told to people, that needs to be communicated, that needs to be we need to educate and motivate the other people, so that there can be employment of proper breastfeeding techniques, right? Okay, so we'll move on to our next question. How much protein is present in 500 ml of cow milk? 10 grams, 16 grams, 32 grams, 20 grams.
16 grams.
Okay, anybody else?
Is bullet B.
Okay. So we'll move on to the answer. So you can see, depending upon the different companies, you might see a different, you might see a little bit of difference here and there. But as you can see here, per 100 ml, the protein content is around 3.2 grams, right? So whenever we are talking about 500 ml of cow's milk, it comes to around 16 grams. So,
Option B.
yes?
Option B, ma'am.
Right, option B. So the correct answer is option B, 16 grams. So you might find a little bit of, deviations from here, where it comes around 15 grams or 17 grams or 16.5 grams. But this is the approximate, where in 500 ml of cow's milk, there is around 16 grams of protein. So we have also talked about the amount of different, macronutrients in the breast milk and in the cow's milk in previous lectures. So the recorded lectures are there. Please go through those sessions and keep on recapitulating. So we'll move on to the next question. Mother wants to increase her breast milk supply. Which of the following will affect it? What do you think will affect the breast milk supply? The options are breastfeeding frequency, time of breastfeeding, mother's weight, baby's hunger levels.
Baby's hunger levels.
Okay.
Even breastfeeding frequency and baby's hunger levels both.
I think all three options are correct, no, ma'am.
Then,
The more
then time of breastfeeding also important.
the more will be the supply of milk, and the more hungry the baby is, the more demand he'll have.
Right. So here, then, I mean, again, the options are interrelated. But whenever we are talking about, the increase, so it should be the breastfeeding frequency. Of course, the baby's hunger levels and the time of breastfeeding, it is also related. But the answer here is breastfeeding frequency, because if you think more the frequency is, so do you remember the role of oxytocin? Can anybody just tell me how is oxytocin related to this? And what is oxytocin?
Oxytocin is the hormone release of milk.
Okay.
Ejection of the milk. So when the baby sucks, that
Right.
prolactin
So-
increases the milk secretion, and oxytocin is ejection of the milk.
Okay. So what we are looking at is the oxytocin. It is a hormone. So what happens whenever there is suckling, whenever the baby is suckling? So why we can, one by one, let us eliminate the options. So baby's hunger levels. So baby's hunger levels, mother's weight, time of breastfeeding, they can be subjective. But breastfeeding frequency, so breastfeeding frequency, so with the increasing number of breastfeeding episodes, say the child, whenever there is the suckling, so that directly mediates that oxytocin pathway. And whenever that oxytocin release is there, so the brain, it gets a signal that, okay, so more amount of blood can be, the more amount of blood can be released. So that is a very important oxytocin pathway, or this is called as the letdown reflex, right? So oxytocin, it mediates the letdown reflex. So what happens? So whenever the baby suckles, so as we can see, I have just discussed about it. So the baby is suckling, and then the breast milk is ejected out of the milk ducts, obviously. And here what happens, it is a continuous cycle. So whenever the baby is suckling, so this oxytocin, the nerve cells in the nipple signal, they signal the brain to release oxytocin. Now the oxytocin, in turn, it causes the muscles in the breast to contract, right? And then the oxytocin, since the muscles are contracting, so it leads to the ejection of breast milk. So again, this is a continuous cycle where the oxytocin is being acting as the letdown reflex, where it is leading to the increased supply of breast milk. And so here the answer would be the breastfeeding frequency, as to how many times the breastfeeding is being done and what is the exact frequency. So if there is more of suckling, there is more of this oxytocin reflex which is being generated, and because of that, the brain will be signaled that, okay, now the oxytocin needs to be released, and then the more of milk supply is also there, right? Okay, we'll move on to our next question. When are the baby's rapid growth periods in which the mother should breastfeed more often?
Point 2, bullet 2.
Okay, anybody else?
Option number B.
Okay. Yeah, right. So,
Option B.
option?
Option 2, B.
Okay. So, I see most of you have said option B. So, can anybody tell me what are these rapid growth periods called as? There's a very specific name for these periods of growth that is seen in children.
Growth spurt. Growth
That-
spurt.
Right, growth spurts. So there are specific, periods during the different lifetime of the child, and the lifetime of the child, and also when they grow up into adolescence. So there are different specific kind of specific time periods when they have a growth spurt. So what happens, their all functionalities, they are increasing at a higher rate, and whenever they are growing more, so that entails that their requirement or the nutritional requirement also increases, right? So whenever we are talking about a baby's growth here, it has been seen that the baby has been they have been seen that they have a growth spurt happen every 3 to 4 weeks. So if we consider that according to American Academy of Pediatrics, the infants or the babies, they have been found to show growth spurts at the beginning of the second week. So the second week, and then again at 3 weeks, 6 weeks, 3 months and 6 months. So if we consider our options, so the second option, which shows the 2 weeks, 6 weeks and 3 months, it is a continuity, right? So this is the correct answer. So please go through the different the specific growth periods or the specific time when there are growth spurts which are observed in children. And what happens? So whenever there is the growth spurt, so the different kinds of the different kinds of features that we have seen in children whenever they are hungry or whenever they are trying to communicate, so all of these also get activated. So there is more of hunger. So since there is increased hunger, so hence the mother should also breastfeed more so that the baby is satiated. Then again, there might be sleep pattern changes. There might be crankiness or grumpiness. The child can become agitated. And also there might be more of the child might be feeling discomfort during sleeping, and all of these features can be there during the growth spurts. So these are specific periods of growth when they are rapidly growing, right? Say for example, when the child is growing, as we call a lag phase, like it's going on, or a stationary phase, not a lag phase, a stationary phase. So the child is growing steadily, and then suddenly there is an exponential phase. So this phase during which the child is having different kinds of growth, the child is having a growth spurt. So these are important phases where the nutritional requirement also increases. So hence it is to be told to mothers who are not informed. It is to be communicated to family members who do not know that there might be growth spurts like this where the baby is more hungry. So they might be, it might happen that during such a phase the baby is crying more, the baby is getting agitated more, and the parents do not know what to do. So it is very important that they are also informed that there will be, these are very physiological or these are very normal phases of the child's growth where they can get agitated, they can get more hungry, and they can cry. So these are like the specific growth spurts or the specific rapid growth periods. Yes, so the answer is 2 weeks, 6 weeks and 3 months. And apart from that, we know that it is a continuity of say 2 weeks, 3 weeks, at 6 weeks, 3 months and also 6 months. So we'll move on to our next question. During
is there any data that shows what is the maximum weight gain during the growth spurt periods?
Okay, so I am not sure at the moment. Maximum weight gain, right?
See, generally a child gains weight an average of 1
Yes.
month, 1 kg per month. Is there any difference between, see, generally what I'm saying is in ICD's growth charts, whenever the Anganwadi worker shows the higher growth, higher weight, generally people question how can the child gain weight like this? Every month she is gaining 750 grams, but now this month you're shown 1.5 kg or 2 kg, something like that. So if there is an understanding of like that,
Yeah, so ideally, if we think like that, of course, the requirements of the child is now increasing because the child is now the growth, since it's exponentially increasing. So of course, the entire requirement of the child's body will also increase. So that might lead to greater increase in weight, but if you specifically need a data, I can figure
Yeah.
that out. Yes.
Yeah, thank you. Thank you.
Yeah. So since the baby is growing, of course, like with age and with the period, since now the baby is growing, of course the requirements will also be high. So more amount of energy is required, more amount of food is required, and so there might be corresponding weight gain as well, which is completely normal. Okay. So during breastfeeding, mother expresses milk and thick milk comes out in a spray. So what should the mother do?
Option B.
Option B.
Okay. Okay. We have gone through this concept a lot of times, I remember myself. So can anybody just recapitulate for me?
The fore milk and hind milk. So see, if the hind milk is there, means actually until the hind milk is completely comes out there, the mother should not change the breast, so that the mother is able to feed the baby with the required fat.
Yes. So as very correctly said, here we are talking about two kinds of milk, which is fore milk and hind milk. So fore milk and hind milk, these are the two types of mature milk, right? So we have seen that whenever the baby is being born, the mother has something called as colostrum, which is the first milk. Then after 2 to 4 days, there is a period of transitional milk. And then after transition milk, there is mature milk. So that mature milk also has fore milk and hind milk. So the hind milk is stored at the back part of the breast tissue, and the fore milk, it is more watery. So the fore milk, it is more, it has more of protein and carbohydrate contents, and it is more watery, and it can flow it is very dilute. But the hind milk, it is more rich in fat. So it is very important that the hind milk reaches the child. It is not that, many mothers might feel that, okay, the the fore milk has been given to the child and now it's okay. But if a child is only fed on fore milk, it might be seen that the child is not getting proper development and the child is not increasing. There is no proper weight gain, the child is not growing properly, there is lesser development, because in hind milk there is a specific kind of fat. Can anybody tell me what is that?
Omega-3.
Right. So omega-3, it is present in hind milk, and in breast milk we know the two kinds of omega-3 fatty acids which are present. These are the EPA and the DHA. So these are very, very important for the brain development, for the eye development, and the heart overall health of the child, right? So these are present in the hind milk. And so the inspection of whether hind milk is there in the breast, or the remnant of after feeding the child, how much of milk is there in the breast. So we have read about the press, compress, and the release mechanism, right? So that is also done to see whether there is remaining of hind milk. So now if we see that watery milk is coming, so if watery milk is coming, we can say that, okay, it is the fore milk. So now the mother needs to keep on feeding the child from the same breast. Again, if we see that the mother is expressing thick milk, but it is coming out in spray, so that means there is still hind milk remaining in the breast, and it is essential that the milk be fed to the child. Again, another kind of inspection is that if hind milk or a thick milk, it comes in drops, say very few drops are coming out. So that means, okay, the hind milk is at the verge of, the breast is at the verge of emptying, and now the mother can shift the baby to the alternate breast if the child is still hungry, right? So at a practical sense, if I say, it is also important to educate people about this fore milk and hind milk. Like, how does the milk, appear? Because, okay, I'll just show it. So yeah, so the fore milk will look different, the hind milk will look different. So there are a lot of women in the rural areas, even in the urban areas. It is very important whenever we see something, we visually inspect something, it becomes easier for us to grasp the concept, right? So the same thing with this. If we educate them, if we tell them that, okay, this is how the milk looks. So the watery part is the foremilk, and the more thicker, creamy, a more yellowish milk, which is the hind milk, which is more richer in fat. So you need to see that your child is getting that. So of course, this is very important, where we can tell them that you can inspect and you can see what amount of milk is remaining in your breast, and based on that you can decide whether to shift the child to the alternative breast, or whether to keep on feeding the child from the same breast, right? So these are all overlapping MCQs. You have gone through it, so just keep on going through the same concepts. It's the same thing, right?
Can I ask you one question here, ma'am?
Yes, sure.
That is it right to conclude that the child need less effort to drink, to suckle fore milk, and more effort to suckle hind milk?
If we talk about suckling, maybe it is more easier, the palatability is more easier, but of course the suckling reflex would be the same, right? So
Okay.
definitely if you talk about the suckling, it is the same, whether or not what consistency of milk is coming.
Okay.
But then that, the receipt of that milk, or the specific consistency and the specific palatability of that milk will differ definitely
Okay.
as to the consistency. Okay. So next question we have, if mother is vegan, what deficiency her baby may most likely have if she is breastfeeding exclusively? Anybody with the answer?
B12.
Option 2.
Okay.
B12.
Okay. Okay. So, yeah, somebody has said, okay. I'll go on to the answer. So, you people are very correct. It is vitamin B12. So, whenever we are talking about vitamin B12 or cobalamin, so the most richest sources of vitamin B12, these are the meat, the non-veg sources, and also the dairy products, right? So this is one of a very important vitamin which is required by the different functions of the body. Now, when we are talking about a vegan mother, we know nowadays a lot of people are turning vegan and they are trying out different kinds of food options, almond milk, soya bean milk in places of the conventional dairy products. So what might happen if a mother who's vegan, or say vegetarian, even this is the same case in case of some vegetarians who do not take dairy products in a very efficient manner, or they are deficient in it. So this might lead to a very major deficiency in the child, in the breastfed child, which is vitamin B12 deficiency. And this vitamin B12 deficiency is one of the important factors which can cause anemia. We have seen how a lot of our children and a lot of our mothers are anemic. It's a huge percentage where there are a lot of anemic people. So this is important, where if mothers are vegan, they are devoiding themselves of the richest sources of vitamin B12, and that can lead to this vitamin B12 deficiency, and hence pernicious anemia, as a matter of fact. Now, there are a lot of studies which have found, these are not very recent, it has been seen in even around 1997, that these kind of vitamin B12 deficiency, it can cause severe neurological symptoms, neurological disorders in the child. So nerve related problems can be caused because of this vitamin B12 deficiency. And in extreme cases, it has been seen that there is even loss of nerve cells, which is called as brain atrophy, right? So these are very extreme cases, and if you are interested, there are a lot of papers which have showed that vegan mothers, when they are breastfeeding, they are actually doing more harm when they are not taking in the required nutrition for them. So this is more harm than benefit to the child when they are devoiding themselves of the specific kinds of rich sources of vitamin B12, like dairy products or other non-vegetarian sources, right? So yes, if it's a vegan mother, vitamin B12 deficiency is a very serious consequence or a very serious side effect which has been seen in a lot of patients. So as you can see in the graph, it shows that if it has been seen in patients who are not having meat or who are vegetarian and who are vegan. So it can be seen that there is increased deficiency of these specific nutrients. But in case of vitamin B12 and iodine, there is marked deficiency. So it might happen that the babies of the vegan mothers, they are severely deficient in iodine, and we all know that iodine is very much necessary for the growth of the different metabolic functions and the entire growth. It is required for the thyroid gland, and how iodine is very, very, very essential for the growth of the child. So as we can see, it's not only just vitamin B12, but it has also shown that it causes the deficiency of iodine, right? And also along with it, it has shown that it can have deficiency of zinc, selenium, and these are also very important micronutrients that are important for the child's growth. So this is very important, where whenever if we come across people who are turning vegan by their own choice, so they also have to be informed that these are some of the consequences that might happen, so that they have a proper they can judiciously make a decision regarding their food choices and how they would go forward with it. So we'll move on to our next question.
Ma'am, can we have some of studies on this with mothers' deficiencies?
Yeah, so I'll just show you. This is one this is one of the papers. You can see there's a DOI number which is given in the slide, right? If you click on that, you can read this paper. But of course, there are a lot of other papers who have reported this specific kind of neurological symptoms in vitamin B12 deficiency, right? So if you want, I can send it to you on email, or even if you just search on Google neurological symptoms related to vitamin B12 deficiency in vegan mothers, or vegan mothers vitamin B12 deficiency, you will find a lot of established studies which are there. Okay. Yeah.
Okay, thank you. Ma'am, one I can ask, I think I wanted to ask in the last, but actually I'm going through your slides. So there we can only see and study, but we cannot download, because now I sometimes have felt, no, maybe it may be useful for use of the educating the mothers and even the communities.
You cannot download.
We are not able to do it.
Okay, I'll check the access. I'll let you know.
Yeah.
But if you are able to see it, I think you can download it also. It shouldn't be a problem.
I tried, ma'am.
Okay. I'll
once
just.
I can see, ma'am. Yeah.
Okay. Let me just finish with the session. I'll come back to you. Okay.
See, what is our observation as a clinician is thiamine deficiency.
Vitamin
Also
B1.
is there,
Yes.
which definitely causes a encephalopathy like things
Yes.
in a babies.
Yes.
Nowadays, we are telling the moment the baby comes, and if there is any problem, even if that baby is a breastfed, we give thiamine injection, that is a vitamin B1.
B1, right.
And B12 also. So definitely vegans are known to cause, and we ask the history. immediately we treat and they get better. So
Yes.
it is obviously it causes a deficiency.
Yes, definitely. As very rightly pointed out by Dr. Patel. So, as we are talking about these sources, so the different vitamins the vitamin B, say vitamin B1, vitamin B12, and the different kinds of folate and all of that we have seen. So, they are present in all of these non-veg sources, dairy products. So, whenever anybody is deficient in it, so there are very specific symptoms that can be seen. You can also see in adults who do not, who keep on, who do not have milk or milk products, they start developing these kinds of ulcerations at the corners of their mouth, which we call angular cheilitis. So these vitamin B deficiencies, they are very major, because we think that okay, we are not drinking milk, what will happen? But these are little things which might cause a very major kind of deficiency in the body of that person. So similarly, it is also for the child. So even if the child is being breastfed from the mother, but still since the mother is not getting the adequate kind of nutritional requirement that she needs, obviously that will be reflected on the child, right? And if there is deficiency, so of course that specific kind of supplementation also needs to be there. And we have also discussed the similar kinds of things in case of iron and folate deficiency, where the mother needs to take that supplementation so that the baby is not affected, right? So related to all these deficiencies, the supplementation at a proper time also needs to be done. Yeah, thank you for the information. So we'll move on to the next question. Yeah, so a mother has sufficient breast milk supply. She wants to give her child 1 to 2 cups of animal milk per day over and above the food she is giving. Appropriate time to do so will be after the baby is, what do you think would be the answer to this? So they are talking about animal milk. So it's a different non-human source of milk that the mother wants to give to the child over and above the breastfeeding.
1 year of age.
Okay. Anybody else?
I think 1 year of age.
Okay. So here let us again recapitulate one concept. What is the time period for complementary feeding? When do we advocate that the complementary feeding should be started? Until what age?
At the beginning of 7th month.
2 years.
Right. So it's from the end of, when the baby has completed 6 months till the 2 years of age. So at that time, what we have advocated, that these are the different kinds of food that need to be given to the baby along with breast milk. So we have studied about 8 major groups. These are essential groups, and food from all these 8 groups need to be given to the baby, right? And if at all it is not available for the baby, still at least food from 5 groups need to be given to the baby. And the major part of this is breast milk. So as we know, the breast milk is definitely superior than any other animal source milk, right? So here, if at all the mother needs, going by the question, if at all the mother wants to give additional milk, she can do that, of course, after 2 years of age, because before that her breast milk is sufficient enough, or her breast milk is credible enough to do the entire kind of nutritional requirement for the child. So any kind of animal milk substitute is not necessary over and above the breast milk, at least till 2 years of age. So as we can see, that at 6 months of age, we know that complementary feeding, at the end of 6 months of age, we are starting with complementary feeding. And then if we start giving animal milk, say we know that breast milk is one group, we have discussed this in our previous session, that no matter what group of food you are giving to the child, but breast milk is one group of food that you have to give to the child every day, right? So now if somebody wants to give more of animal milk, so what does that do? It compromises the intake of that child. So now the child will be full, the child has got breast milk, the child has got animal milk. Now the child is already full. The stomach is this much. There is no more space to have the other nutritious food. So this is disadvantages. So the mother will be inadvertently depriving her child of the different kinds of nutritious food which is available, the sources of vitamins, the sources of minerals, the different vegetables, fruits. So that definitely is not beneficial for the child, right? So now at the age of 2 years, when the child has got a considerable nutritional requirement, and the child is at a stage where now the different metabolic systems, they can take care of themselves. So after that, it is a possible time. Now it is not being said that okay, you have to give, but it is possible that the mother now can give after 2 years of age, but definitely not at 1 year of age, where still it has got the requirement which needs to be fulfilled by breast milk, right? I hope I'm clear with this question.
Yeah, thank you.
Yeah.
Yes, ma'am.
Right. Okay. So this was the last question for today's session. But before moving, ending this session, I would just like to suggest you people, please go through the previous sessions. And since we are almost at the verge of completing our lectures and all of it, so in case you have any doubts, or in case if you want me to discuss any problems related to any specific concept, please let me know. Either you can mail me, or you can also put it up on the question tab on the portal. So I hope I had given my mail in the class Monday. So do you people have it, or should I give again?
Yeah, ma'am, we are not having your email ID, ma'am.
Okay, I'll just write it again.
Can I ask one question of this
Yes, sure.
9th assignment?
Yes, 9th assignment. Okay, go ahead.
So the question number 5. A mother wants to feed a ragi for each to her baby. What are the 2 steps she should take before cooking ragi to get the maximum benefit of its nutrient for the baby?
Huh.
Because the way they appear all the options. Like first option is ragi should be soaked in water for 6 to 8 hours and sprouted. Second is ragi should be dried and fried. Ragi should be ground and roasted. And ragi should be dried and powdered.
Okay. So
It
before
appears first one for me, I don't know.
Yeah, so before anything else, the ragi should be it should, the first option which says that it should be soaked for at least 6 to 8 hours, and it should be sprouted, so that it is more palatable for, for preparation of the food. So the first option should be the answer.
Thank you.
Yeah. So are there any doubts related to previous sessions or anything? So I have, Ananya Bajpai, why are fruits added to the baby's diet only after adding all other food groups? To give less vitamins, to give more breast milk, to limit the colors in food, to introduce other taste. Okay, so the answer to this question is to introduce other tastes before sweet taste, right? So we have discussed this in the previous session. If you go through the recorded lectures, we have very clearly discussed as to why it is important to introduce the other kinds of taste to the child first, right? Because if the child now gets a hang of that sweet taste, so it will be more, deviated towards the sweet taste. And also it has got more of sucrose and all of it, which is definitely not nutritionally significant or nutritionally helpful for the child. So the answer to this question is to introduce other tastes before sweet taste. Anybody else with any other queries? Yeah, so as I was saying, the recorded lectures are there. So I'll just clear it out for all of you again. So this problem solving session sheet that you see, so it has got the names of both the PMRF TAs who are taking sessions, and there you will find my name Sharmishtha, and in that sheet you will see the different YouTube links of all the sessions that I am taking, right? So with every week the sessions are there, and this recorded session will also be uploaded there. You can go and you can watch the recordings, and apart from that there is a folder where all these presentations will be uploaded, right? So you can go and have a look from those presentations also. And as I was saying, that in case you have any doubts from the previous sessions, like all the different sessions that we have had till date, and if you want me to go over any topic or any kinds of specific problems, you can send me an email, or you can also raise your query in the portal, right? So, and one more thing regarding Mr. Vemula's query. So I'll just check whether it is downloadable or not. But as far as I know, since you are able to access it, you should be able to download it as well.
I tried, ma'am.
Okay. Okay, maybe I'll just check it and I'll let you know. Right?
Okay, ma'am. Thank you.
Okay. So, any other queries? Yeah, since I mean,
If I may be doing wrong, yes, any one of our team members.
yeah,
able to
if
download?
anybody is able to download any this presentation, maybe you can just confirm. So the presentation links are also there on that problem solving sheet. So you will get all kinds of the presentations and also the links to the recorded lectures in that sheet. Okay, then I think we'll wrap up for today.
Excuse me, ma'am.
Yes.
One question was asked about ragi. I couldn't hear the answer. Can you please
Yeah,
repeat?
the answer is the first option, where it needs to be soaked into water for 6 to 8 hours and then sprouted. The first option is the answer.
Okay, thank you so much.
Okay. Thank you. So we'll meet again the next Tuesday, and we'll be talking about the different topics that you'll be going through in week 10.
Ma'am, actually, I had just seen that videos,
Yeah.
and the questions also gone through, but only the preparation of the recipes are focused on more on this. Maybe it may not be, I think, proper material I found. Maybe I may be wrong, but I'm not saying that it may be wrong. But most of the videos, 3 videos, of course, 4 videos are focusing on the preparation of the recipes actually.
Okay.
But questions
Like,
are different.
are you saying for this week's content?
Yeah, for the following content, maybe 10th week.
Yeah, so that is actually decided by Dr. Rupal Dalal. So, of course, whatever content is being given to you, you can just go through it, because, as I said, the first one is related to the issues with complementary feeding. So, and the rest of, since the recipes are also very important part of this course, so hence those recipes have been given as separate lectures, right? So of course that is decided by her, so there is nothing that I can say.
No, what I'm saying is that questions asked.
Yeah,
maybe
questions
not,
questions
matching
will
actually.
not come from recipes. That I have made clear also.
Yeah.
Questions will not
Yeah.
come from recipes. Recipes are for our knowledge, recipes are for our practical
Yeah.
implementation, because this course is all about practical knowledge, right? So yeah, recipes, you won't be getting any kinds of problems or any kind of questions from recipes. That is all for our knowledge.
Okay.
Okay.
Thank you.
So I hope there are no other queries. In case you have queries, you can always email me, right? Okay. So we'll meet again next Tuesday. Good night, everybody.
Thank you, ma'am. Thank you so much
Yeah. Thank you.
for your time.
Thank you very much.
Thank you. Thank you.
Thank you.
Thank you, ma'am.
Thank you. Thank you for joining, all of you.
Thank
Good
you.
night. Yeah.
Thank you, ma'am.
Thank you so much.
Yes, you have raised a hand. Do you have a query? Or it is okay.